My name is Philippe and I'm from Victoria, British Columbia.
Okay. What got you interested in the medical cannabis movement?
For me, it was kind of a personal introduction. In 1995, I was diagnosed with hepatitis C, which I'd contracted in 1982 through tainted blood in Ontario. It was actually a time when we were buying our blood in Canada from the U.S. prison system, something even the U.S. wasn't allowed to do at the time. And unfortunately, a lot of people in Canada ended up getting infected because our government wasn't testing for hepatitis at the time in our blood supply. And for me in 95, when I got diagnosed, doctors didn't know much about hepatitis C. Being a naturally curious person, at the time I was in school to be a teacher, to become a secondary teacher, secondary school teacher, I started doing a lot of research to determine whether or not the cannabis I was using might be harming my liver in any way or making my condition worse. But the more I looked into the research, the more I found that the research suggested that it could be quite the opposite. The cannabis could be very helpful for people with hepatitis C in terms of suppressing viral load, in terms of reducing inflammation, and helping me deal with some of the symptoms of hepatitis C, the localized pain, nausea, vomiting. And so it was quite a relief to see that, but it also made me think that we were getting a lot of misinformation from our government in this issue at the time. And and so that was really how I started with my use of medical cannabis. And the more I learned about it, I started to learn about supply issues. And I figured that if I myself, as a 25-year-old male at the time, was having trouble finding a safe supply of cannabis, a standard, an easy, a ready supply of cannabis, then there must be other people who are having the same trouble. And if you were, heaven forbid, a 60-year-old woman who'd never had experience with medical marijuana and had just been diagnosed, say, with breast cancer, you'd have no idea how to go about getting cannabis, preparing it and making it available to yourself, how much to use, what strains might be most helpful. And that's what got me interested in trying to improve access for people who need this substance.
Okay.
In Canada, we actually have a federal medical marijuana program, and so there's currently about 2,300 Canadians who are legally allowed to access cannabis. Unfortunately, our government estimates that there's currently about 1 million Canadians who actually claim to be using medical marijuana, and we see that despite having a federal program, overwhelmingly, the overwhelming majority of medical cannabis users in Canada aren't protected from arrest or prosecution. So that's been a major problem and issue, and something that I've been working on over the last few years to get some recognition for community-based dispensaries and community-based access to medical cannabis, to decentralize our federal program, to ensure that every medical cannabis user in Canada is protected for their legitimate use. Over the last few months, I've had the privilege of working with a few people who are using cannabis at the end of life, and it's never the most cheerful part of my day to work with someone in end of life, but I think it's the most important work that I do to some extent. And these poor folks who've been given, say, 2 weeks or 2 months to live can't go through our federal program and die protected. It takes a minimum of 8 weeks to get an application through our federal program. And so there's absolutely no means for these people to die without, if they're using medical cannabis, to die without breaking the law. And that's an absolutely ridiculous proposition when you've got terminally ill patients who have to break the law in order to spend their last few weeks with a little bit more clarity and a little bit more pain reduction, and just feeling a little bit more themselves for the last few weeks of their lives. And it's always amazing to hear how that's helped not only the people in question, but also their families, because that makes the last few weeks that they have with their loved ones that much more precious. If you can reduce the suffering of those people, it can really help those last 2 weeks to be very, very special. I've always wanted to ask policymakers who are against medical marijuana what they wouldn't do to help someone that they love, help reduce their suffering. And I think that the answer is pretty clear. When it comes to the people that you love, you would do anything that you can to help them and to reduce their suffering. And I think that that's why this movement has such wide support, whether it's in the US or in Canada. The general population is absolutely on side with medical cannabis, with over 80% support. This isn't a hot potato for politicians to take up. this is, I can't, it's hard to think of another public health policy that would have such broad popular support. And so I don't think there's excuses from our elected officials right now to not support opening up safe access to medical cannabis.